Hello everyone, this is Adina with Cheng Plastic Surgery. I am the patient care coordinator here, and we're going to go over post-operative instructions for lower eyelid surgery. In our practice, there are several options to tackle your lower eyelids. Most common is removing skin from the lower eyelid, and then we may do an inside approach or outside. Sometimes it's a combination of coming from the inside, repositioning fat, and then also removing a little bit of skin, which we refer to as a skin pinch. And in some cases, if you do need a little more volume, we may combine fat transfer to help with any volume loss in this area here. So today we're going to go over what that looks like as far as your post-operative instructions. Your supply list and your post-operative instructions we'll go over with you 3 weeks before, because there are specific things that we will want you to avoid and continue avoiding, and other things that will promote healing. With that, you want to have your supplies on hand. So she's already had lower eyelid surgery. Today she's going home, and then she needs to worry about cleaning and making sure that she is taking care of those incisions. For the first night, we do encourage that someone help you with that, just because you may be a little bit out of it from surgery. And then by the next day, you're going to be a little more with it, so you'll be able to tackle this on your own. But hydrogen peroxide on a Q-tip, you're going to follow along the lash line. Again, this is if you have an incision on the outside. And then you're going to take a dry Q-tip and you're going to just mop that up, so that way when you go to put your antibiotic ointment on, it goes onto a clean and dry incision. Now that you're going to apply and then just follow along just the lash line here. A little goes a long way. We make sure that you have additional tubes just so that you're not having to go to the pharmacy and pick up more. After that, you're putting in either your ointment inside of the eye or your drops. Now, typically you're going to have the most swelling at day 2 and 3. So the surgery day is considered day 0. The following day is 1, and then 2 and 3 are going to be kind of your peak for swelling. In between that, you're going to, after applying your ointments, you're going to put your bruising cream, and that you're just simply going to tap onto the area that's bruising. Even if you don't notice bruising at first, you want to stay ahead of the game. You can't overdo it, because that will just help the bruising. And adhering to the list of things to avoid and things that will promote healing. Fresh pineapple, fresh papaya, those will be all things that can help you. And of course, we're always available to help you with any questions that you have. After you have applied your ointment and your bruising cream, then it's really important that you try and ice as much as you can throughout the day. And simply for that, you're just putting ice either individually on each side, or peas work really well. So frozen peas, what I recommend for that is open up the bag of peas, put it in a little Ziploc bag, so that way you just have individual size pea frozen bags, lay them flat, and it really just molds nicely against your face, and the peas stay cold for a little bit longer sometimes than the gel pads do as well. The other thing that I think is really helpful is as you're resting, sometimes the bag of peas won't really stay in place, so having like a little headband is really helpful, because you can go ahead and place that over the eyes and rest, and then you can put the peas inside, or the frozen gel pads there. The circular gel pads work really well as well, because they'll just focus on each little eye area here. But really, most important, it is to make sure that that incision stays clean and that you're putting your antibiotic ointment. Now, the most common thing that you're going to experience post-surgery is bruising and swelling, and then dry eye. So with eyelid surgery, you want to make sure that those eyes stay lubricated. You'll have a nighttime ointment that you'll put in at nighttime, and then if you're taking a nap, we encourage that for the first day, just so that you don't have to worry about putting in drops. And then once you want to see a little more clearly, you're going to use your daytime drops. There's a few different products that we recommend for that, and you're putting it right into the eye. The other thing that I think is really helpful to have on hand is down the eye care aisle, you'll also find like a saline eye wash. In the mornings when you wake up, you're going to experience blurry vision. Putting in that saline wash will kind of flush out the ointment that's in there. You can see clearly, and then you can transition over to the daytime drops. You want to keep this guy around. He will be your friend. Put him in your pocket. Every 30 minutes to an hour, you're going to want to put that in. You want to stay ahead of any itchy, scratchy, watery, or tearing of the eyes, that is dry eye. So you want to just, again, lubricate really well so that way your eyes feel really comfortable and clear. If they feel red or irritated and you want to kind of get in there and be sandy, use that ointment, flush out with, again, saline, and then put the daytime drops in. It's pretty straightforward. In some cases, again, we may also, if we're approaching it from the inside, you will not have an outside incision, but you may have a CO2 laser. In that case, you're going to use an acidic soak, you're going to clean the area underneath, and then you want to make sure that it stays hydrated with a Aquaphor type of balm. You're doing that 4 times a day. So think breakfast, lunch, dinner, bedtime. That will be your routine. You want to set everything up either on your vanity or in your bathroom so that way you have a mirror as a reference, but you're going to be able to do a lot of this on your own. It's always helpful to have someone around just to help, a little healing buddy, so that you're not doing it on your own. But again, by the next day, I think you'll be good. Important again to sleep with head elevated, think head above your heart, so an extra pillow. A lot of patients post-surgically will also get the wedge pillows. I think that's really helpful. Of course, if you have a adjustable mattress, that really helps as well, but just think head above your heart. You don't want to lay flat because that will cause more bruising. So I think that is lower eyelid surgery. Again, always reach out if you have any questions and we can help you in your journey.